How proud are you today? Let's hear that. Oh, come on, that's it? Come on. I missed a lot of the sessions here on the business side, but on the clinical side, just having the kind of people, so within CVR, people who were visiting us today, it's just amazing. This is where we are. And guys, as you all say, this is just the beginning. So give yourself a big round of applause as we get started. So I just want to welcome everybody, first of all, from CVR who's come here. And you guys have obviously, traveled. You've got to try to finish your work ahead of time so that you can make this weekend available to everybody. And thank you for doing that. And then secondly, we've always talked about CVR as a family. As we found out that there are other doctors some of them who are looking to join CVR, some of them just are esteemed guests who are going to be here to give us a talk. We found that out. A lot of the CVR physicians just offered, here, I can help take care of Dr. So-and-so. I will just be their shadow. What a great family. It's like a big family wedding going on where everybody's saying, I will take care of the guests. So from the side of our CVR physicians and CVR staff, I really also want to welcome all the other esteemed colleagues, absolute national and international authorities who are here today to educate us. Thank you so much for being here. I want to thank our vendors. Guys, it's without your help, these things just are not possible. We're all trying to do the best in the very little amount of margins that we all have. And you guys stepping up and helping us educate ourselves, educate everybody else. Really want to thank you for being here, guys. Big round of applause. I want to thank our board members. Jeff and Jeff, if you could please stand for a second. Coming here, giving us your weekend. Really appreciate you being here. And Jamie, as the larger we get, the bigger a target sign on our back, right? It's unfortunately one of the facts of life is that the outside world assumes because we are doing well, we are doing bad things. And to have a very strong compliance group on our side is so critical. You got to first of all do the right thing, and then you got to make sure that you're protected. And Jamie, you've been our compliance superhero. Thank you so much, along with Curtis, for being there for us. Last but not the least, I would like to, so everybody here has gone into making this happen, but there are some people who've really, for the last month, they've probably not even slept. I would like each one of you to please stand. Nidhi, Amanda, Manzoor, Vinny, Bill, and so many other people who've done that. So don't want to miss any names, but you guys have just been absolutely outstanding at this. So welcome everybody to this talk. At one of our Christmas meetings this time, Ken was the one, Ken Wen, who said something which initially, as he started saying, everybody was like, what? And then it made sense. What he said was that that he loves raking leaves. And I was like, why on earth would you love raking leaves? And his point was that as I look at my yard and I start raking, and I rake a part of the yard, and the rest of the yard is still full of leaves, and as I look at that part, I can feel happy for the progress I have made till that moment. And I still know, hey, I've got a lot more to do, but this is our moment today to look at the part of the yard that we have successfully raked. And rather than just trying to be happy, trying to be perfect, let's look back at 2019 and what all you achieved during that year. This is where your CVR is today. We are at 84 sites as of the last count. We have over 500 full-time staff members, 64 physicians. We added more since I made the slide. And just Think of this number. Last year, Center for Vein Restoration saw 40,000 new patients. 40,000 new patients in 1 year and almost 200,000 patient interactions. That is more than the population of some small countries in the world. This is what you all are doing. This is what you're accomplishing. And then look at the other side of the map. And a point I'd like to make here for some of the physicians who are considering joining us, we're obviously in the Amtrak corridor, but then also as we look, we went to Dothan, Alabama. We went to Alaska. Don Ives, if you could please stand for a moment. Don, where are you? Still? Okay, thank you, sir. But the point here to make is anybody would think, why on earth would you want to go to Dothan, Alabama or Alaska when there's so much of the rest of the country still wide open? And it goes to the core of who we are. We are so physician-centric that we got to find the right physician, and we believe that once we have the right physician partner, our business side will do an absolutely amazing job to support that physician with all the support they need to succeed. And Dothan converted, Trip Todd, because of his health, could not make it here, but Dothan became one of our top centers. As Dr. Ives has promised me that next year Alaska will be our top region. So it's just amazing how partnering with the right physician, a philosophy we've had right from day one, is really what makes it happen. So how did CVR do last year? Right, so we take pride in the fact that we are a medical practice at our core. How should any medical practice, whether you're a hospital, whether you're a healthcare system, how should they judge themselves? One thing and one thing alone, your quality of clinical outcomes. Everything else is secondary, tertiary. How did we do? How did we perform for the patients who trusted us? If you look at these clinical outcomes, VCSS score improvement according to increasing level of SEEP, and I'll not read everything, but it's those of you who are familiar with this know that these are absolutely spectacular results. And it's not just that the results that are spectacular. What all did it take from the beginning to have this kind of data, where every one of you who's a medical assistant, a nurse, an LPN, a vascular tech in the office, collecting the right VCSS score, and then the operations team making sure that these patients came back at 6 months, making sure all patients did not come back at 1 year, but a significant subset came back at 1 year. And we all know you can do an ultrasound scan in 20 minutes. What makes it go to 40, 45 minutes? What causes all the frustrations is the data recording that goes with that, right? And we are gradually trying to make it more and more easy, but it's still a pain. But it is because of that pain that you've put yourself through that we are the only organization. Other people are at a rush to publish their data with incomplete information. You are the only organization that has the data to publish, and I'll go through this, that now that we have the people who can help us do that, but these outcomes, they don't just belong to the doctors. They belong to the entire organization that did their job at every level so that 2019 became such a successful year for CVR. So, of course, clinical outcomes are great, but as Agassi would say, it's all about the image. If your image is not what it needs to be, perception is reality. How did we do from a net promoter score standpoint? How did the patients, you can build a beautiful, solid house, but if people don't think it's pretty or it's people who are going to live in it are not happy with that, it kind of doesn't work out. So for those of you who are not familiar with net promoter scores, a net promoter score is like, at least when I did my medical school entrance test, it was if you get the question right, you get 2 points. You get the question wrong, you get negative 2 points. And if you leave the question unanswered, you get a 0. So Net Promoter Score is something like that. If the patient says they loved you, you get 1 point. If the patient says, so it's like a 7 or so out of 10, then you get a 0. But if the patient gives you a 4 or 5, then you get a -1. To put this in context, most hospitals are in the, and hospitals have a lot more to deal with than what we do, but again, contextually, they are at about a 10 or a 15. CVR consistently scored in the 80 range. A good month was 90, a bad month was 78. And we'll talk a little bit more about what goes into this, but this is so what you did provided excellent quality outcomes. Not just that, your patients also loved you. This is the data that goes back to the referring doctors, not as NPS scores, but as your patient going and telling the referring doctor, hey, thank you so much for sending me to Dr. Stewart. So again, something else in 2019 you need to be very, very proud of. Now, as I've said earlier, we are assumed to be guilty unless proven otherwise. It is the job of the various organizations, whether it's Medicare, CMS, Blue Cross, to always constantly audit us. As the largest provider of vein care in the country now, if they are not auditing us, they're not doing their job. And because of that, we have to be paranoid. We have to, first of all, do the right thing, which I have absolutely no doubt that every one of our physicians, every one of our providers is here to do the right thing. However, being able to record that, being able to document that out of 100 patients that are referred to us, right? So, sorry, I'll say it. Out of 100 patients we see, on an average, 80 to 85 are referred to us. So this is where some referring physician felt that there is some disease going on. Out of that subset of patients, we recommend procedures to 43%. Then, because of some reason or the other, they don't finish their compression stocking trial or whatever, about 35% ultimately get procedures. And out of the ones who get procedures, it's in the first year, it's an average of 1.9 procedures per patient. So if you take the whole subset of 100, it's 0.9 procedures per patient. It's 1.9 now. There is some discrepancy in the data since Palmetto and all allowed Varithena to be done for tributaries. Those Varithena patients are not in this subset, but this is what we are doing. You will see data published every day where somebody would say, I do 1.2, I do 0.9, or I do 1.7, but nobody tells us what percentage of the patients did they operate on. If you're operating on 90% of the patients you're seeing and you're coming up with an average of 1.9, that's a whole different ballgame than saying I'm operating on 43%. And then people would say, oh, my patients are sicker than yours. But when your subset, when your denominator is 40,000 new patients a year, this is such strong data, and this would not be possible without Rohan, who got the Best Director Award last night, without every one of you doing what you do every day in your clinics. Let's talk about what else did we achieve in 2019, right? Our research program, we are now so proud of that. You can keep, there's a saying in India that if a peacock dances in the forest, nobody sees that peacock. Here, if we can keep saying, hey, we did 1,000 cases, we did 500 cases, whatever, unless we don't publish it, and we don't publish it right, it is pointless what we are doing. First of all, we don't learn anything from it, and we don't share for the world to learn from it. So we are consistently publishing every year more than any other organization with respect to venous disorders. And I put that image of Dr. Sufyan in there because without Dr. Sufyan beating us up at that time, we would not have collected the data, and he would never have started the research program, then to pass the baton over to Dr. Pappas, who again needs no introduction. Now, Dr. Pappas has taken it to a whole different level with a full research committee. Now we have people like Dr. Morrison. You know, our initial data, we would have published 40,000. First of all, I would not have the mental ability to do that. But if we would have published 40,000 patients, nobody would have believed us. Now, since we have people like Dr. Pappas and Dr. Morrison saying, yes, guys, this is true, that is how the world is believing us and getting to see what you all have been doing for years. We've also recently, under Dr. Pappas's leadership, hired a full-time director of research. Is Arpita here? Arpita she is an PhD and an MBA, and her role will be to take our research program to a whole different level so that we can actually continue our contribution to the field. Education. It is, believe it or not, a part of the Hippocratic Oath that as we do better, we will educate the next generation. Education is hard. Letting people operate on your patients when you are trying to impress the referring doctor is a big deal, but somebody did it for us. And now it is our turn to do it to the next generation, to help the next generation do better and better and be able to serve, especially in a field like venous and lymphatic disorders, where, you know, it's still a field trying to get credibility, trying to be recognized. And again, it goes back to Dr. Pappas, who is willing to give his weekends, his evenings, to get this program going, to give us direction. And then a lot of the other doctors here who are willing to give that education. You know, educating people like research doesn't pay. It's just a fact of life. This is what you do to get your final stage of the Maslow's triangle, which I'll go back to. But this is how we feel fulfilled ourselves, and that's the kind of team we have. And Stephanie, are you here? Stephanie Westy. Yeah, over here. Okay, so Stephanie used to work with Dr. Pappas when he was at the university, and we are so fortunate that Stephanie has also come with him to help us grow this program. We are now the largest program in the United States training venous and lymphatic fellows. Next part is, how did CVR keep its commitments to people who trusted CVR, right? Ultimately, and I'll get to that, we want to continue to grow, but you continue to grow as long as people who come join you, like yesterday I was telling you, when Ken joined, that was without a contract. The next 7 people Ken brought was again without a contract. It was a handshake, and that's how we have grown as an organization. We can have 2,000 contracts, but if at the end of the day, we did not keep our promise, nobody else will trust us. So last year, over the last few years, physicians who have joined forces with us, this is what we've done for them. This is what you all have done for them, that their average new patient growth has been 15% in 2 years, their average growth. And as we, obviously when you acquire a practice, you've got to pay a price for it, and the price is paid over a period of time. And common question asked by the physicians who join us is, oh my God, so is there a way that you will not pay me? We have a 100% track record that every one of those physicians is still with us, and they have gotten paid 100% of their purchase price. So we take our promises very, very seriously, and that's what you achieved last year. I'm going to take a couple of extra minutes on this slide because I think it's very, very important for folks in the clinic level, in our offices, to understand what the second part of what we do is. Our patients, we get that. Our patients trust us, they believe in us. They will let us do whatever usually we want to do to them. I mean, this is, again, very simple surgeries, but as you were hearing, a lot of you are from backgrounds where you may do bypass surgeries, whatever kind of life-threatening surgery. A patient has probably never met you before they see you in the emergency room, and the next thing is you're opening somebody's chest up. Imagine, when you want to buy a TV, you research it for like 20 days, and this is your going somewhere and letting somebody replace 3 valves when you've never met that person. Imagine the kind of trust they're putting in you, and it behooves you to respect that trust. The same thing happens here when a lot of you invest in mutual funds. You know, your parents have invested for their retirement. We all have invested for our retirement. There's the teachers, there's the firefighters. And how I got to know this, when I was at one of our private equity, our investors group meeting, you talk to the people who are there representing, oh, I represent the Firefighters Association Retirement Fund. Or I represent one of the guys was the Danish Citizens Retirement Fund. So they put their trust into a vehicle which would be their 401k fund or their retirement fund, which then further puts their trust into established, well-respected private equity funds or other institutional investors, who then spend a year or so trying to find where can we invest, so that just like it is our job that our patients do well, it is their job that they keep their promise to their investors. So how did we do for that teacher and for that firefighter in 2019? We produced excellent financial results for them. People who believed in us, we again have kept their promise, and that is because you all used your resources very efficiently. You know, we don't waste any wires, we don't waste any catheters, so that we can keep our promise not just to our patients, but also to the people who believe in us at all different levels. You know, Dean Bender is here today. Thank you, Dean, for being here. We are very, very proud of our partnership with the American Venous and Lymphatic Society. That is our national organization. Dr. Morrison has been the leader for that organization for the longest time, and a lot of other people here are a part of that. We totally are absolute followers, partners of our national organization, with education, advocacy, and research as your 3 pillars. We completely get it. You do all the work you do so that we can practice out in the field. Personally, I have this 4th pillar, which is we have to continue to fight to bring credibility to our field. And that, again, can only happen through the things that we talked about earlier. So from every angle, whether we look at clinical outcomes, we look at how we were perceived, we look at how we did for the people who believed in us with their retirement funds, 2019 was an absolutely spectacular year for us. All of you, I'd really like to give yourself a great round of applause here. This was absolutely an amazing year. I'd like one other thing. I'd like, please, all the CVR physicians to stand up for a moment. So, 2 things here. One is thank you, and the second thing is I want each and every one of you to realize you get the glory, but you get the glory because of what everybody else around you does. So you need to please thank everybody else for doing what they do. And this is the team here, you know, and I'll move on to the next slide here. This is so critical. Yes, ultimately we talk about clinical outcomes and net promoter scores, but how can you see 40,000 new patients a year? How can you see 200,000 patient interactions a year? How can you do your research that is so close to your heart and your publications and everything else? It's because of everything else that really, from if we were to track a patient, from how is a lead generated, what did your marketing department do, what did your sales division do to generate those leads, bring those patients in, talk to the referring doctors, what did the PSC do to make sure that those calls were taken with Neil, what's our latest abandonment rate, 0.5%? So less than 0.5% of the calls that come into our call center are not answered less than 0.5%. That's what it takes. Then patients are recorded, and earlier when I came in, once patients get an appointment, there is a whole team working to make sure that the no-show cancellation rate is less than 5%. We're not there yet in all of our offices, but we're getting there. So for whatever reason, whether CVR cancels or other people cancel, we are shooting for a no-show, no-call rate of less than 5%. And in some of our offices, we are there. Imagine the amount of hard work going there. Then the patients coming to the office, the ops team, every one of you, the net promoter score, believe me, the physician sees the patient for probably, and I'm just guessing here, 10% of the time that the patient is actually in talking situation, right? When you're operating, you're really not talking, but otherwise. So the net promoter score really talks about the whole organization. How everybody from the first phone call onwards, revenue cycle, making sure very politely you're collecting what is owed to you, all that goes into the net promoter score. So there's so many people working to get everything done. And then there's something that weaves everywhere, which is IT infrastructures, compliance, as I talked about. And it's really, so when we are talking again and again about compliance, it's what I'm really not bothered about is what you are doing in the clinic, because I know every one of you, whether you're a vascular tech, whether you're a nurse, whether you're a physician, you're there because you want to do the best for your patient. But at times, it may not be perceived that way. When you're asking the vascular tech to repeat the study, take an extra 5 minutes to tell her why are you asking her to repeat the study. Because that's where most problems that I've seen come up from, that a vascular tech thinks, oh, till I'm not going up to giving you a positive study, you're going to keep asking me. No. I know this referring doctor. This referring doctor is very, very serious about sending a patient. And I also know if I miss disease and the patient goes back to the referring doctor, he or she will get very upset with me. So when I'm sending the patient back, I just want to be 100% sure that this patient does not have disease. Let's communicate a little bit more with them so that'll decrease our down the road dissatisfaction that people may have. And like anything in life, most problems do come out of lack of communication or less communication. So we've got to continue to decrease the workload on that side through better communication. Finance. Listen, guys, that's, I still remember once I was taken to task at one of the New York meetings that, oh, Sanjiv's business works through budgets. Oh my God, how bad do they have to be that they have to build budgets? And coming from a clinical background, I completely get it, that the first time we had to build a budget, I was like, oh my God, budgets are for, for countries. The budgets are not for CVR. Let me tell you where I am today. How do you plan a year without a budget? How do you decide I'm going to hire 20 people or 5 people? How am I going to open 20 new offices, 5 new offices? So budgets are not made because we are pushing somebody to generate a certain amount of revenue. Budgets are just made so that we can actually grow the business in a planned, organized manner. And it is important that we communicate this to every new physician who's joining us, also to every new vascular technologist who is joining us, that guys, this is just trying to do things in a more organized manner, and we may not be, first of all, we don't have the need to do it when whatever's left at the end of the day, that goes to the physician's practice or home, and you just plan because you're going to work harder, or if the reimbursements go down, okay, I'll do 100 more cases. But to run an organization, a budget is an absolutely essential thing. So communicate that. But the point of this slide again is, which again, Manzoor spent a lot of time, Vinny, Manzoor, and coming up, I was just trying to give them the concept, and it's just turned out to be, to me, such an amazing, true depiction of what CVR is.